Presentation of dialogue on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore family's legacy of building the great state of Idaho.
Coming up, should Idaho help all parents pay for required childhood vaccines? The state was doing that and then it stopped. It started up again for now, but what's next? We'll talk about it on Dialogue. Hello and welcome to Dialogue. I'm Marcia Franklin. A welcome as well to our listeners on public radio and the World Wide Web. And Dialogue's now on Facebook, YouTube, and Twitter. Check us out. This past week, the Centers for Disease Control released new figures on immunization rates across the country. Now, those rates are based on how many children aged 19 to 35 months have a required series of shots. And Idaho, with a rate of 60.4%, is second to last in the nation, with Montana having a slightly worse rate. The national rate for vaccinations is much higher at 76.1%. Now, Idaho's low rate comes despite the fact that the state has been subsidizing the cost of required childhood vaccines for all parents, regardless of their income or whether they have insurance. As part of a budget-cutting measure, Governor Otter and the legislature pulled money from the Vaccines for Children program this past session. Beginning July 1, all parents with insurance that covered vaccinations were to start paying for those shots. But an outcry from private physicians who would now have to purchase the vaccines at a much higher rate, as well as from parents and public health officials, forced the state to change course for now. It's back to paying for all required vaccines. But Governor Otter says that will change come January 1. So is there a creative solution to this funding problem? Should the state even be involved in subsidizing vaccines for every household? And why does Idaho's vaccination rate continue to be so stubbornly low? Here with us to discuss these issues are four guests. Senator Dean Cameron, a Republican from Rupert, is co-chair of the Joint Finance and Appropriations Committee and also co-chair of the legislature's Healthcare Task Force. Welcome and thanks for driving in.
Glad to be here.
Appreciate it. Rebecca Coyle is also here. She's the manager of the state immunization program for the Idaho Department of Health and Welfare. Thanks for being here.
Thank you.
Dr. Tom Patterson is a pediatrician at the Saltzer Medical Group in Nampa. He's also the co-chair of the Idaho Immunization Coalition and vice president of the Idaho chapter of the American Academy of Pediatrics. Thanks for being here.
Thank you. It's a pleasure.
And Russell Duke is the director of the Central District Health Department, which services Ada, Boise, Elmore, and Valley counties. Welcome to you.
Appreciate the invite.
And we'll be taking your calls on our toll-free line, as usual, 1-800-973-9800. Well, first, I want to talk about vaccines, but Senator, I would be remiss in not asking you about the latest budget figures that have come out today, which show tax revenue down nearly 7%. We now have a projected more than $150 million shortfall in the current fiscal year, which just started in July. Do you think we're going to be seeing holdbacks?
Well, I don't think there's any question the governor's going to have to issue some level of holdback. We'll be having a meeting with him shortly to discuss what alternatives that he has and try and work together with him. I don't see any way around not having a holdback. Obviously, we keep hoping that revenue will improve, particularly sales tax revenue will improve. We anticipate income tax revenue staying low because that's a lagging indicator a year long.
Now, you were quoted in the Twin Falls Times-News as saying that you would be supportive of cutting whole agencies like the Department of Agriculture and Parks and Rec. I'm sure you got some phone calls on that. Was that an accurate quote?
No, it wasn't actually, and it's been misquoted repeatedly over time as it's been passed around. First of all, I was asked a question as to what do we do if the economy continues to drop, if we have 15% reductions and our reserve accounts are gone, and we were asked a hypothetical question. It was my mistake for answering the question. And obviously the answer is that you then have to look at ways, you have to prioritize what's important and what's not. And our role and mission of our state is to protect the public health and safety of our citizens as well as the education of our children. And so that's our highest priority, and that was what my real quote to them was. There have not been, let me be very clear, there have not been any discussions about eliminating any programs or any agencies, and I'm not advocating that we do that. It was a hypothetical question, should we have serious problems down the road?
Well, let's segue here to the vaccine program, because these are some of the tough choices that you have to
Sure.
make as a legislature. Originally, as I said in my introduction, the state cut money out of this, and everybody with insurance was now going to have to pay for their vaccines. Your task force subsequently wrote a letter to Governor Otter saying,
Sure.
we agree, we feel that you should find the money for this. Why was that so important?
Well, I think first of all, the decision was made during the legislative session based on a series of information, and every legislator and governor has to make decisions based on the information given to them at the time. We were told that we'd have stimulus dollars to help prop up or replace those general fund dollars. That didn't occur. We were told that most of the insurance plans would cover immunizations right up front, and that's partially true with some plans, but not with other plans. We were told that they would be able to put together a purchasing pool, be able to obtain the vaccines at a discounted rate. That didn't take place. All of that fell apart after the session, after we were through with the session. And so the legislative task force, and I have to tell you, I'm proud of the task force because first, nobody liked the situation we were put in, and nobody liked that things weren't working out. And I was proud of the task force that they stepped up. It's very unusual, even though this task force has accomplished a lot over the last several years, very unusual for them to make action when we're not in session. In this case, they voted unanimously to send a letter to Governor Otter. Very grateful to Governor Otter for listening, for hearing our concern. He was equally as concerned. And
the concern was that people would not get vaccinations.
That's correct. That's correct. And the concern was that parents wouldn't take their children to get vaccinations because of the high cost and the confusion that was there.
But the money probably won't be there to keep propping this program up.
Well, obviously that's the next step, and I'm sure you want to get to that at some point. Where do we go from here? The governor did agree with us. He took money from his reserves that we had given to him during the session, which was kind of an unusual thing for us to do, but we did that because we knew there would be unintended consequences of some of the decisions we made. This became one of them. He chose to pull money out of those reserves and pay for it till January 31st, giving us a window for us to evaluate and figure out how
Is it January 31st, or it's December 31st, isn't it?
I thought it was January 31st, but I could be wrong.
It's supposed to be 6 months, which
Really? 6 months?
puts us into late January.
Okay, great. Thanks for clarifying that.
And so then between now and then, we've got an opportunity to find out how we're going to fund it, how we're going to improve our immunization rates, how we're going to allow people to have access to those vaccines.
Rebecca Coyle from the Department of Health and Welfare, why couldn't a pool or consortium be started? Why couldn't players be brought to the table to replace the state monies? Say
Well, I think
insurance
players
companies
were
and-
brought to the table.
and pharmaceutical companies. What happened?
Well, I think there's a collective group of very interested and I'd say folks who really have a passion for making sure that children get vaccinated. The issue then became whether or not we could actually get a contract that would then cover all of the vaccines for all the kids up front at a reduced rate. And in the end, we ended up with only one pharmaceutical company taking a bid. And what they came back with was at retail prices, or in some cases higher than retail prices.
Why?
So no cost savings.
Why?
I can't speak for them, I'm sorry.
Yeah.
I don't know.
Yeah. So let me ask you, at Central District Health Department, you're on the front lines of seeing people who want to be vaccinated. What have you seen as a result of all of this changing? What did you see first when people were told that if they had insurance, they had to pay for their shots?
What we actually saw at Central District Health Department, and you got to remember we're one of 7 public health districts around the state, was a fairly sizable increase in demand for services at our agency because we have generally a lower cost as well as sliding fee scales for families.
I think we've got some footage as well from Central District Health that we took, yeah.
Well, great. And so we actually saw quite an increase, but that's not the case for all the public health districts. In District 7, for example, based out of Idaho Falls, they saw an overall reduction in demand for services, and then in North Idaho, it seemed like it was pretty level. So I think it varied from around the state, and part of it depended on the providers' reactions. We actually know for certain there were a number of providers here in Ada County referring their patients to us, the insured patients.
Right. So let me just throw this all out to you. If somebody has insurance, just like with anything else, shouldn't they be paying for their own vaccines? I can understand, they're going to cover uninsured people or people on Medicaid, but why should somebody with insurance get help from the state? Anyone want to take that?
Well, first of all, I'll tell you, I guess I would respond by saying, why should a parent who's bought insurance, has done the right thing, be penalized and be forced to pay those upfront costs when the state has been providing that service in the past? Now, obviously, the insurance companies, I think, have a role to play, and I appreciate Rebecca's comment, because a number of the companies, Blue Cross in particular, stepped up to the plate big time, was willing to fund everything up front and run it through the state, but we still couldn't get that lower bid. So we've got some work to do to figure out how we get the insurance industry, those insurance plans, to pay for those coverages up front. And then I think we can resolve some of the other issues. We don't want to penalize parents or kids because they've got insurance. I think that's the public policy decision that my colleagues would make.
I think the feeling of penalization is one that is very real in the clinical setting, where parents that had insurance felt very much like they were being treated differently because they had insurance, because they had jobs, because they had this set up with their insurance company, that the insurance company wasn't necessarily paying for the vaccines. They were getting them through the state. We had a very short window of time to prepare these patients for that change where they would be paying for it, and it really, quite honestly, took people by shock. They didn't have time to prepare for that.
And your group went ahead and purchased a lot of vaccine. The doctors in your group went ahead and proactively spent a lot of money buying vaccine, thinking that the state wasn't going to do it.
We have immunizations as one of our top priorities in my clinic. When I started at my clinic 11 years ago, we really had district health offices doing many of the vaccines, and so my colleagues and I, we brought in immunizations to the clinic. Really, we have a full-time RN, registered nurse, who does all of our vaccines, all of our accountability. We have invested a lot of resources into the vaccine program, and so we have size, so we were able to get discounts through purchasing agreements, and so that's what allowed us to go. It's the small guy, the small clinic that sits in rural Idaho that really doesn't have the resources to do what a larger group the size of Saltzer Medical Group was able to do.
And are you going to get reimbursed now that the state has gone back to purchasing all that money that you spent on the vaccines, and other doctors probably did too? Is insurance going to reimburse you for that, or how are you going to?
The understanding is that we will be reimbursed, but it's a significant expense. Our 10 pediatricians had $105,000 worth of purchased vaccines for the month of July. We went through $84,000 of those vaccines, and I am just now hearing that we are getting some reimbursement, but that's from very few sources. So we don't know really whether we're going to get reimbursed. The word is that we will, and we're having confidence that we will get reimbursed. And so the main priority is getting the vaccine to the child and protecting them from vaccine preventable disease. So that's our main focus.
We'll circle back around to the funding, but I want to talk about the vaccination rate in Idaho, and look to the public health folks here. We have a map that I just took the western part of the United States, and the states in the orange are the ones like Idaho that are still continuing to heavily subsidize immunizations for both insured and uninsured people. And you can see it's all over the place. I mean, we have a very low, as I said, second to last vaccination rate in the country. Others have higher. Washington State, which is about to do away with its universal program, has higher. But other states that don't have the subsidization have higher rates. So is it even helping to have all these subsidies if our rate's so low?
I think that's one of the difficult things to say, is that if you subsidize vaccines, parents will come and they'll vaccinate their kids, and I don't think that's been the case in Idaho. So I think we have much larger issues that we need to work on as well. This simply throws another barrier into the mix, and it's creating more obstacles for parents, and I think it's going to decrease our rates even more.
Is that your sense as well?
Yeah, I would agree that the universal status isn't the solution, obviously, that it hasn't worked. Some of the challenges we face, we know, for example, by the time a child turns age 1 is where we start to see a decline in the doses administered from age 1 and beyond.
Why do you think it is? I'm wondering, why do both of you think that our vaccination rate is so low?
Well, I guess my thought on it is there's a number of issues. Like I say, even if you look at our our state policies that we have for mandates, school mandates, child care mandates. They're not up to the standards set by the Centers for Disease Control. I also think we have a registry, and the level of participation could be better. And I'm not saying that it's not being used. It is being used, but it's not really being used as a reminder system, or certainly not to the level it could be. And I think that's where maybe other states are doing a little bit better job. Some states actually have opt-out versus opt-in for the registries, and that can make a difference getting a registry populated with data.
You're talking about the opt-in issue in the schools. So you're talking about Idaho having a pretty lenient policy. Is, a parent can basically say, for any reason, I don't want to have an immunization. And do you think that affects our rate?
I think you can definitely see that the trend is definitely increasing in the exemptions for both school and for childcare. Yes.
And what is the pool of people that needs to be vaccinated before we have breakouts of disease? I assume we're we're under immunized.
We're definitely under immunized. Typically, you want to see vaccination coverage levels in the 90s to prevent outbreaks. And we're significantly below that in this state.
So we're at 60.4%. I think we've got a call holding. Josh and Payette. Josh, go ahead, please.
Yeah, my question is if the number of vaccines have increased and the number of autistic kids have increased, if they see a relation in that.
Okay, thank you very much. Another reason that people don't immunize is frankly the fear of the shots. So there's two questions kind of in there. One was so many shots. They increased. And in fact, we saw one child getting 8 shots. 8 shots, 4 in each arm. That's a lot of shots to keep up with, to pay for, and then in some people's minds, it puts a stress on the child system.
So, to answer the first question, in terms of the number of shots, we're really looking at a large number of public health threats in terms of vaccine preventable disease. And as new vaccines come to the market, that's an entire segment of children and adults that we can protect from vaccine preventable disease. I'll just give my own experience. When I began training in '91, the Haemophilus influenza type B vaccine for meningitis from Haemophilus had just been released. I've seen one case of Haemophilus influenza meningitis in my career. Shortly thereafter, in 1998, pneumococcal vaccine, a type of meningitis, bacteremia, pneumonia, was released, and we don't see pneumococcal meningitis anymore. If you look at rotavirus vaccine, that's been out now several years. The birth cohorts are almost all immunized against rotavirus now. And we used to admit maybe 6 or 7 kids a week with rotaviral gastroenteritis, dehydration, serious illness. And last year I admitted, I think, 1 child with rotavirus disease. So it's an entire disease that's been transformed in the way we think about it. So pediatric hospitals, small pediatric units, are actually suffering because they don't have patients because of a vaccine. That to me is beautiful. If you look at chickenpox, it hasn't been widely accepted in Idaho. We're still seeing cases of chickenpox. We still have 6 children die a year in Idaho because of chickenpox, and it's a vaccine preventable disease. So as you look at, we gain more knowledge of disease states, we learn more about how to protect ourselves, we develop vaccines, they go through stringent safety studies before they ever hit the human population, then safety studies in the human population.
So the autism link, briefly, in your mind, yes, no exists?
So there's not a single bit of data done in a good scientific fashion that supports that the measles, mumps, rubella vaccine causes autism. There's not a shred of evidence anywhere. If you look at the way we diagnose autism, when I sat in medical school my first year in 1991, we were taught don't even look for autism before age 2. And now when your baby is in the newborn nursery, I'm looking for autism. At 1 month, I'm looking for autism. At 2 months, I'm looking for autism. We've redefined what autism is. We include a large number of children that have Asperger's, which is a subtype of autism. So it's a spectrum from very minimally affected children. Some people are engineers when they grow up. They're scientists. They're very high functioning to a terribly autistic child who suffers severely. So if you look at the rate of measles, mumps, rubella, it's dropped off with an effective vaccine program. the rate of autism can be explained by a broadening of the diagnosis, the broadening of the definition. We have huge numbers of data that show first child immunized with MMR got autism, fear of the vaccine came up, parents didn't immunize their second child, the second child got autism. So I have families where the child, 2 or 3 of the children have autism, a parent has autism, a grandparent has autism. So we know there's a genetic link.
I'm sure you hear constituents with this concern
Sure.
as well, and from a public health standpoint, how are you dealing with that? And then we'll get back to the issue of cost here. But how are you approaching this issue of fear? A lot of people have never seen these diseases, of course.
Correct. From our perspective, our nurses basically talk with the patients and let them know, provide them with the facts. And as Dr. Patterson just stated, there's no evidence. Certainly, there's the Wakefield study that's really behind a lot of this, and that's since been retracted by most of the authors behind that. So
it is a lot for people to keep up with. I printed out the immunization law. There's a lot of shots on this page. A lot of people, can't find daycare to get their, or get time off from their job to go get their child immunized. I mean, it's a pretty big task to keep up on it all.
But I would also say that when you have a child that's sick with chickenpox for a week, 2 weeks, that's time that parent has to take off and care for a sick child, not a well child, a sick child. So I think it may seem daunting up front, however, the benefits far outweigh the risks.
And if we look at the medical home concept of a child receiving health care, vaccines are part of that medical home. They're given in the medical home. They're given at the doctor's office. So if we can move towards a system of healthcare delivery that includes the medical home as the pinnacle of healthcare, that's what we all aim for.
Medical home, what is that?
Medical home is a concept that has been originated by the American Academy of Pediatrics. Now it's widely accepted. It's part of healthcare reform. It's a doctor who's available 24/7. You can do all of your healthcare needs in the same location.
And really the legislature, to segue on that, the legislature took steps to improve medical home concept here in the state of Idaho. It's where a patient they would know who their physician is, and rather than showing up at the emergency room,
right.
if they've got a problem, they know who to turn to.
It's so basic.
Right.
Well, let's talk about the funding. We've got very little time left.
Sure.
What do we foresee here? We've got a couple months to work on this. I mean, Washington State's been working on this issue for the better part of a year now.
Sure.
What would you all like to see? Best case scenario for funding of this?
First of all, we've appointed a subcommittee of the Healthcare Task Force. I and Representative Collins will co-chair that subcommittee, and we'll begin working. We're not going to solve it overnight, and perhaps the biggest problem that we would have is if we tried to take it all on at once. So our first charge is to how do we get things back to where they were, whether we go back to the universal process or not, and how we fund it from there. The insurance companies, the providers, everybody that's involved will be at the table, and we'll find a solution by the end of January.
Can't the insurance companies purchase in bulk the way the state can?
Well, they tried that, and
okay.
that's where the bid came in at retail cost. Now there may be some other things that we can do to improve that bidding process, if you will, or we can allow the state to buy it,
Well, yeah.
and then have the insurance companies help pay for it through the state. The insurance companies already pay a premium tax. We have part of that premium tax going towards the S-CHIPS program and the access card, and part of it going towards the high-risk pool, which is a healthcare program. Both of those have funds potentially available that we can help transition
From a premium tax on insurance.
from a premium tax. Those are just some ideas that are out there, but we got a lot of work to do, and I would be misleading you if I said I had the full answer right now.
Physicians in the state now, having seen this up and down, what's the relationship between, how are doctors feeling about this whole situation? It seems rather confusing. They couldn't get the shots, and
It's created a significant amount of anxiety in many practices. Roughly somewhere between 25% and 33% of physicians said we're only going to give vaccine for children funds, meaning we'll only give shots to those children that are vaccine.
Medicaid, uninsured, that they know that they can get reimbursed for. Because we should say to the viewing public, whatever else, the Vaccine for Children program still exists for people who are uninsured, for people on Medicaid, for Native Americans, and for people whose insurance does not cover vaccines, and that will be that way. But what you're saying is some doctors chose to just say, okay, I'm only going to take those patients.
Yes, and some groups got out of the immunization business entirely, and then other groups took high financial risk to continue with a kind of universal program. I, fortunately, in my own practice, did not have a single patient go without vaccines during that window of time where we were doing private purchase vaccines, but also I was willing to eat the cost if insurance
and you have big
reimburse me.
refrigerators. We've been to your office. You know, you have to
we
keep
were
things
set
at
up to do
yes,
it.
not every doctor has a refrigerator like you do to keep everything cold and separated between different types of, you know, VFC and non-VFC patients. It's difficult. We see the refrigerators here, and you can see some just delineated state vaccines. You've got to separate everything out.
And Marcia, I do want to point out, even though again we're currently covering those uninsured and Medicaid patients, but right now even the fully insured patients, fully insured
Yes.
children can go get the vaccines.
Yes.
I think some people are still confused. And because we were able to react so quickly, and even though there's been a lot of media play on it, I think there are some parents that are confused. Well, am I going to have to run it through my insurance or not? For now, you would not. You could run it through the state until January 31st. So if your child needs immunized and you've got insurance, you better go get it done before January 31st, and then hopefully we'll have a solution beyond that.
Are you feeling optimistic as Director of Immunizations for the whole state?
You know, if I can say nothing else, I think over the last 6 months, it has truly raised awareness of the overall issues with immunizations, and that's something that this state has desperately needed for some time.
And you too, feeling optimistic?
Absolutely. I mean, the public health districts are absolutely committed to providing childhood immunizations, and will continue to do so regardless what happens to the funding situation.
So you'll continue to purchase in bulk yourself?
We will continue to purchase it, and we actually have the opportunity, because we're a government agency, to purchase at a greatly reduced rate. It's not quite what the state can purchase the cost, but it's significantly less than what the private sector has to pay. So we're going to continue to do it beyond January 31st.
So if for some reason you have insurance and you're not covered, you can go, will you bill insurance for people? And
we absolutely will bill insurance, and all 7 public health districts will be set up to do that.
Interesting. Well, thank you. We have been talking with 4 very informed guests on the issue of vaccination, the Vaccines for Children program. And if you want more information, please go to our website. And as I indicated at the top of the program, we're now in the 21st century. We're on Facebook, or YouTube, Twitter, you name it. And you can check us out there. We appreciate you tuning into Dialogue, and we hope you'll join us same time next week.
Presentation of Dialogue on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore family's legacy of building the great state of Idaho. To order a copy of this program from Idaho Public Television, call our toll-free number or visit us on the World Wide Web.
Go beyond, it'll be work for a couple years. I mean,
Yeah.
even if we get the funding restored.